Hello everyone and welcome to today's presentation. Today we are going to talk about diabetes. Diabetes mellitus. That's what we are going to talk about today. So this will be our outline, or these topics or these subtopics are what we are going to talk about. We look at some few key facts about diabetes. You have a look at the overview of diabetes, the symptoms of diabetes, the types and causes of diabetes. Then diagnosis, how to diagnose diabetes. We will look at some preventive measures, the risk factors of diabetes, then how to manage diabetes, and also the health impact of diabetes. But before we proceed or before we go on, don't forget to subscribe to this channel. Subscribe, hit the bell so that you'll be notified anytime a new video is uploaded. Also, don't forget to like and also share this video and leave all your questions or comments in the comment section. Thank you. So, key facts. Diabetes affected 422 million people in 2014, up from 108 million in 1980. Compared to high-income countries, prevalence has been increasing more quickly in low and middle-income nations. Diabetes is a significant contributor to renal disease, heart attacks, strokes, blindness, and lower limb amputation. Age-specific diabetes mortality rates increased by 3% between 2000 and 2019. An estimated 2 million people died in 2019 from diabetes-related renal damage. Type 2 diabetes can be prevented or delayed by maintaining a nutritious diet, engaging in regular physical activity, maintaining a normal body weight, and abstaining from tobacco use. Diet, exercise, medication, and routine screening and treatment for complications can all help treat diabetes and delay or prevent its effects. The overview of diabetes. A series of illnesses known as diabetes mellitus alter how the body utilizes blood sugar or glucose. The cells that make up the muscles and tissues rely heavily on glucose as a source of energy. It serves as the primary fuel for the brain. Diabetes develops when your body's cells are unable to absorb sugar or glucose and use it as fuel. As a result, your bloodstream begins to accumulate additional sugar or glucose. Diabetes that is not properly managed can have catastrophic effects and harm a number of body organs and tissues, including the heart, kidneys, eyes, and nerves. Each form of diabetes has a different primary etiology. However, diabetes can result in an excess of sugar in the blood regardless of the type you have. Serious health issues can result from an excess of sugar in the blood. Type 1 diabetes and type 2 diabetes are chronic diabetes diseases. Diabetes disorders, including gestational diabetes and prediabetes, may be reversible. Prediabetes is a condition when blood sugar levels are higher than usual, but not high enough to be classified as diabetes. If no action is taken to avoid it, prediabetes can develop into diabetes. The majority of the food you consume is converted by your body into sugar or glucose, which is then released into your bloodstream. Our pancreas releases insulin when your blood sugar levels rise. In order for blood sugar to enter your body cells and be used as energy, insulin functions like a key. When you have diabetes, your body either produces insufficient insulin or uses it improperly. Too much blood sugar remains in your bloodstream when there is insufficient insulin or when cells cease reacting to insulin. That can eventually lead to major health issues like renal disease, eyesight loss, and heart disease. Your body breaks down the food you eat into different nutrient sources as part of the digestion process. Your body converts carbohydrates from foods such as bread, rice, and pasta you eat into sugar or glucose. When glucose in your bloodstream, it needs assistance. That's a key to enter your body's cells, which make up your body's tissues and organs, and are where it will be utilized. Insulin serves as this support or this key. The pancreas, an organ situated behind the stomach, is the gland that produces the hormone insulin. Insulin is released into your bloodstream by your pancreas. The door in the cell wall is unlocked by insulin, allowing glucose to enter the cells of your body. So this hormone called insulin controls blood sugar levels. Uncontrolled diabetes frequently causes hyperglycemia, also known as high blood glucose or raised blood sugar, which over time can seriously harm many different bodily systems, including the neurons and blood vessels. 8.5% of persons who were 18 years of age and older had diabetes in 2014. A total of 1.5 million deaths were directly related to diabetes in 2019, and 48% of these deaths occurred in those under the age of 70. Diabetes contributed to an additional 460,000 renal disease deaths, and high blood glucose is responsible for 20% of cardiovascular fatalities. If you have diabetes, your pancreas doesn't make any insulin or enough insulin, or your pancreas makes insulin but your body cells don't respond to it and can't use it as it normally should. Your blood glucose level will increase if glucose cannot enter your body cells and instead remains in your bloodstream. So, how common is diabetes? In the United States, 34.2 million individuals of all ages, or nearly 1 in 10, have diabetes. A little less than 3% of all individuals in the United States, or around 7.3 million people, are ignorant that they have diabetes. As people get older, more people are getting diabetes diagnosis. About 1 in 4 persons, that's about 26% of those over 65, have diabetes. So let's look at symptoms of diabetes. Symptoms of diabetes. Symptoms of diabetes. The severity of diabetes symptoms is influenced by blood sugar levels. Some people may not exhibit symptoms, particularly if they have type 2 diabetes or prediabetes. Symptoms of type 1 diabetes frequently appear suddenly and are more severe. So, some of the symptoms of diabetes are: 1. You urinate or pee a lot, often at night. Feeling more thirsty than usual. You lose weight without trying to lose weight. You are very hungry, or you normally get very hungry. You have blurred vision. Have numb or tingling hands or feet. Feel very tired. Have very dry skin. Have sores that heal slowly. Presence of ketones in the urine. Now, ketones are a byproduct of the breakdown of muscle and fat that happens when there is not enough available insulin. Also, feeling irritable or having other mood changes. In women, dry and itchy skin and frequent yeast infections or urinary tract infections. In men, decreased sex drive, erectile dysfunction, decreased muscle strength. So, types and causes of diabetes. Types and causes of diabetes. There are three main types of diabetes. We have type 1 diabetes, type 2 diabetes, and gestational diabetes. That is diabetes while pregnant. So let's have a look at type 1 diabetes. This kind of diabetes is an autoimmune disease, which means your body unintentionally starts attacking itself. In this situation, your pancreas's insulin producing cells are killed. Your body's production of insulin is stopped by this reaction. Blood sugar can be used as fuel by your body cells with the aid of insulin. So in the absence of insulin, blood sugar cannot enter cells and accumulates in the bloodstream. The body is harmed by high blood sugar, which also contributes to many of the consequences and symptoms of diabetes. Type 1 diabetes affects up to 10% of patients with the disease. Typically, children and young adults receive the diagnosis, but can develop at any age. Diabetes used to be called juvenile diabetes. Those who have type 1 diabetes must take insulin daily. It is known as insulin-dependent diabetes for this reason. Type 1 diabetes affected 9 million people in 2017, the majority of whom reside in high-income nations. Currently, no one knows how to prevent type 1 diabetes, but it can be managed successfully by 1. Following your doctor's recommendations for a healthy lifestyle. 2. Managing your blood sugar. Also, getting regular health checkups. Getting diabetes self-management, education, and support. The onset of symptoms may take only a few weeks or months. The first signs usually appear in childhood, adolescence, or early adulthood. Type 1 diabetes symptoms may not appear for months or even years. But once they start, symptoms might become very bad. There are several symptoms of type 1 diabetes that resemble those of other medical diseases. Visit your doctor to have your blood sugar checked if you suspect you may have type 1 diabetes. Diabetes can cause very serious, even fatal health issues if left untreated. Causes of type 1 diabetes. It is believed that an autoimmune reaction is what causes type 1 diabetes. That is, the body attacks itself by mistake. The beta cells, which produce insulin in the pancreas, are destroyed by this process. Before any symptoms show, this process can continue for months or even years. Some persons are more likely to acquire type 1 diabetes due to specific genes, that is, traits passed down from parent to kid. Even if they carry the genes, many of them won't get type 1 diabetes. A virus or other environmental cause may potentially contribute to the onset of type 1 diabetes. Type 1 diabetes cannot be brought on by diet or lifestyle choices. So these are some of the causes of type 1 diabetes. You can see from this picture: endocrine diseases, hereditary predisposition, autoimmune disease, viruses and infection, etc. Now let's look at type 2 diabetes, that's the second form of diabetes, type 2 diabetes. The body's inefficient use of insulin causes type 2 diabetes, also known as non-insulin dependent or adult onset. This particular type of diabetes is primarily brought on by increased body weight and inactivity. Your body struggles to properly utilize insulin in type 2 diabetes, making it difficult to maintain normal blood sugar levels. The majority of diabetics, that is about 90 to 95%, are type 2 diabetes, or they have the type 2 type of diabetes. It takes years to develop, and adults are typically diagnosed with it. The majority of persons with type 2 diabetes are over the age of 45, but it is also more common in kids, teenagers, and young adults. Type 2 diabetes symptoms frequently appear gradually over many years and may go unnoticed for a long period. In certain cases, there may be no symptoms at all. It's crucial to get your blood sugar tested if you are at risk, because you might not have symptoms at all or might not even be aware of them because they appear gradually over years. Type 2 diabetes can be prevented or delayed with healthy lifestyle changes. So this picture is also talking about type 2 diabetes. So the glucose enters bloodstream, glucose unable to enter the body effectively. So the diagram starts from here. Stomach converts food to glucose. So you eat carbohydrate and then it is converted to glucose. Now the glucose enters the bloodstream and the pancreas produces insulin. Once the glucose enters the bloodstream, the pancreas produces insulin, but then the body cannot use it efficiently. As a result, the glucose is unable to enter the body effectively. Then what happens? Once the glucose is unable to enter the body effectively, then the glucose levels increase, resulting in diabetes. So type 2 diabetes can be prevented or delayed with healthy lifestyle changes such as losing weight, eating healthy food, and being active. Although frequently less severe, the symptoms of type 2 diabetes might be comparable to those of type 1. As a result, the condition may not be discovered until after it has developed problems. So, causes of type 2 diabetes. Your pancreas produces the hormone insulin, which functions as a key to allow blood sugar to enter your body cells for use as fuel. Insulin resistance, which occurs when cells don't react to insulin as they should in people with type 2 diabetes. To try and elicit a response from cells, your pancreas produces more insulin. Your blood sugar eventually rises as a result of your pancreas's inability to keep up, which can lead to type 2 diabetes and prediabetes. High blood sugar harms the body and increases the risk of renal disease, heart disease, and other major health issues. So these are some of the causes of type 2 diabetes from this picture. Now let's look at the third type of diabetes, which is gestational diabetes. Gestational diabetes. Some women experience this type of development while pregnant. After pregnancy, gestational diabetes typically disappears. However, if you have gestational diabetes, you are more likely to eventually acquire type 2 diabetes. If you have gestational diabetes, your unborn child may be more susceptible to health issues. Your child has a higher chance of being obese as a youngster or adolescent and going on to acquire type 2 diabetes. Pregnancy-related diabetes or gestational diabetes typically has no symptoms. Between 24 and 28 weeks of pregnancy, Your doctor should check you for gestational diabetes if you're expecting. You can adjust as necessary to safeguard both your health and that of your child. So this is gestational diabetes. So the mother has high blood glucose levels, and then this brings extra glucose to baby and causes the baby to put on extra weight. Causes of gestational diabetes. During pregnancy, the placenta releases hormones that increase insulin resistance in your body cells. Insufficient insulin is produced by your pancreas to overcome this resistance. There is still too much glucose in your blood, and it causes the gestational diabetes. So, this picture says the exact causes of gestational diabetes are not known, but pregnancy hormones, as we already talked about, are believed to contribute to this type of diabetes. So now let's come to diagnosis for type 1, type 2 diabetes, and also pre-diabetes, how we can diagnose these forms of diabetes. To determine whether you have type 1, type 2, or pre-diabetes, you must get your blood sugar analyzed. Results of testing are typically readily available and straightforward. To confirm the diagnosis, your doctor will have you undergo one or more of the blood tests listed below, or one or more of the blood tests that we are going to talk about. The first blood test is A1C test. A1C test. Your average blood sugar level over the previous 2 or 3 months is determined by this test. An A1C of 5.7% or less is considered normal. 5.7% to 6.4% denotes pre-diabetes, and 6.5% or more denotes diabetes. So the A1C test is often referred to as the HbA1c test or the hemoglobin A1C test. And the primary test to assist you and your healthcare team in managing your diabetes. It is one of the often utilized tests to diagnose prediabetes and diabetes. If you have diabetes, it's crucial that you meet and maintain your personal A1C goal because higher A1C levels are associated with problems. Hemoglobin, a protein found in your red blood cells, binds to sugar as soon as it enters your bloodstream. Although everyone's hemoglobin has some sugar connected to it, those with higher blood sugar levels have more. The A1C test calculates the proportion of your red blood cells with hemoglobin coated in sugar. The more hemoglobin with sugar link you have, the higher your blood sugar levels will be. So we can see from this picture, A1C level of less than or equal to 5.6. That's normal. If you have prediabetes, it means your A1C will be between 5.7 to 6.4. And then if your A1C is 6.5 or higher, it means you have diabetes. Several factors can falsely increase or decrease your A1C results, including kidney failure, liver disease, or severe anemia. A less common type of hemoglobin that people of African, Mediterranean, or Southeast Asian descent, and people with certain blood disorders such as sickle cell anemia or thalassemia, may have. Certain medicines, including opioids and some HIV medications, blood loss or blood transfusions, early or late pregnancy. This blood test doesn't require not eating for a period of time. It doesn't require you to fast before you take the test. That's the A1C test. Now let's look at the second test. That is fasting blood sugar test. Fasting blood sugar test. Your blood sugar is measured here after an overnight fast, that is not eating. Fasting blood sugar levels of 99 milligrams per deciliter or less are considered normal. 100 mg per dl to 125 mg per dl are considered to be pre-diabetic levels, and 126 mg per dl or above are considered to be diabetes levels. You won't be allowed to eat anything the night before, and then a blood sample will be taken. That's after you fasted overnight. So this is the fasting blood glucose level. The normal is 80 to 100. If you have pre-diabetes, 101 to 125. And then if you are diabetic, 126 and above. And this is the glucometer with a strip. Now let's come to the third type of test, glucose tolerance test. This test checks your blood sugar levels before and after consuming a glucose-containing beverage. Before the test, you will fast and have blood drawn to check your fasting blood sugar level. After consuming the liquid, your blood sugar level will be monitored an hour, 2 hours, and perhaps 3 hours later. A blood sugar level of 140 mg per deciliter or less at 2 hours is regarded as normal. 140 to 199 mg per dl denotes prediabetes, and 200 mg per dl or above denotes diabetes. So before the test, no food or drink 8 to 12 hours prior to test. Then you drink glucose or glucose drink. So blood is tested 2 hours later. And then if you have high glucose level, means you have diabetes. Another type of test, the random blood sugar test. Random blood sugar test. This gauges your blood sugar level at the moment of testing. You don't have to fast before taking this test. You can take it whenever you like. If your blood sugar is 200 mg per dl or greater, you probably have diabetes. Now, diagnosis for gestational diabetes. We've looked at the various diagnosis test or the various tests for type 1, type 2, and prediabetes. Now, let's look at the diagnosis or the various tests that can be used to diagnose gestational diabetes or diabetes during pregnancy. Blood tests are used to determine gestational diabetes. Between 24 and 28 weeks of pregnancy, you will likely undergo a pregnancy test. Your doctor might test you early if you are at a higher risk of developing gestational diabetes as a result of having more risk factors. Early in your pregnancy, blood sugar levels that are higher than normal could be a sign of type 1 or type 2 diabetes rather than gestational diabetes. So, glucose screening test, another test for gestational diabetes. This gauges your blood sugar level at the moment of testing. 1 hour after consuming a glucose containing liquid, blood will be collected to measure your blood sugar levels. The results should be 140 mg per deciliter or less. You must have a glucose tolerance test if your level is greater than 140 mg per dl. So you first consume a glucose containing liquid, and that's what you can see from this picture. Also, glucose tolerance test. Tolerance test, which is another test for gestational diabetes. This checks your blood sugar level before and after consuming a glucose containing beverage. So before the test, you will fast and have blood drawn to check your fasting blood sugar level. After consuming the liquid, your blood sugar level will be monitored an hour, 2 hours, and perhaps 3 hours. The amount of the glucose drink you consume and how frequently you test your blood sugar can affect the results. So, what do your test results mean? A blood sugar level less than 140 mg per dl or 7.8 millimole per liter is normal. A reading of more than 200 mg per dl after 2 hours means you have diabetes. A reading between 140 and 199 mg per dl means you have prediabetes. So you can see this picture, we've already seen it when we talk about the various tests for type 1, type 2, and the prediabetes. So the same explanation for this one is the same type of test. So no food or drink 8 to 12 hours prior to test. You drink a glucose containing drink. Then blood is drawn and tested. That's 1 hour, 2 hours, 3 hours. And then if you have very high glucose level, then it means you have diabetes. So let's answer this question. What happens if my blood glucose level is low? Someone will ask this question. What happens if I get tested and my blood glucose level is low? So having a blood glucose level that is lower than the normal range, that is usually below 70 mg per dl, is called hypoglycemia. This is a sign that your body gives out that you need sugar. This is a sign that your body gives out that you need sugar. Symptoms you might experience if you have hypoglycemia include weakness or shaking, moist skin, sweating, fast heartbeat, dizziness, sudden hunger, confusion, pale skin, numbness in mouth or tongue, irritability, nervousness, unsteadiness, nightmares, bad dreams, restless sleep, blurred vision, headaches, seizures. You might pass out if your hypoglycemia is not managed. So glucose level. This picture is talking about hypoglycemia, that is low blood sugar. So you can see this is the blood and this is the sugar. Only one sugar here. But at normal level, from this picture, you should be having more than, let's say, one sugar in it. Then we are going to talk about another one, which is hyperglycemia, when you have high blood sugar. So from this picture, you can see the excesses of these white substances that's depicting sugar here. So hypoglycemia, it means you have a very few sugar. In this picture, you have only one sugar here. So this picture is just telling us or showing us the meaning of hypoglycemia, the normal level of sugar, and then hyperglycemia. So another question, what happens if my blood glucose level is high? If you have too much glucose in your blood, you have a condition called hyperglycemia. Hyperglycemia. Hyperglycemia is defined as a blood glucose level greater than 125 mg per dl while in the fasting state, that is nothing to eat or drink for at least 8 hours. Or it can also be defined as a blood glucose level greater than 180 mg per dl 1 to 2 hours after eating. So you can see hyperglycemia. We've already seen it from the other picture, but this picture is also talking about hyperglycemia. So normal blood glucose level, you can see few sugar in the blood or normal sugar. So 1, 2, 3, you can count them. But then if you have high blood sugar or hyperglycemia, you have a lot of glucose or a lot of sugar in your bloodstream. Prevention of diabetes. How to prevent diabetes. So let's look at how to prevent type 2 and gestational diabetes. How to prevent type 2 and gestational diabetes. Lifestyle measures have been shown to be effective in preventing or delaying the onset of type 2 diabetes. To help prevent type 2 diabetes and its complications, people should achieve and maintain a healthy body weight. Avoid tobacco use because smoking increases the risk of diabetes and cardiovascular disease. You should also eat nutritious foods. You should eat nutritious foods. You should pick foods with more fiber and fewer calories and fat. Put an emphasis on whole grains, veggies, and fruits. Consume a nutritious diet such as the DASH or Mediterranean diet. Keep a meal journal and track of all the calories you consume. You can lose half a pound per week by cutting your daily calorie intake by 250. You should also get more physical activity. On most days of the week, try to get in around 30 minutes of moderate aerobic exercise, or try to complete 150 minutes or more of moderate aerobic exercise each week. Take a brisk daily stroll as an example. Break up a lengthy workout into shorter periods throughout the day if you are unable to fit it in. You should also lose excess pounds. If you are overweight, even a 7% weight loss can reduce your risk of developing diabetes. If you weigh 200 pounds, for instance, decreasing 14 pounds can reduce your risk of developing diabetes. You should also limit your alcohol intake. Men should drink no more than 2 alcoholic beverages a day. Women should drink no more than 1. So this picture is talking about some 4 simple ways for prevention of diabetes. So regular health screenings, healthy diet, exercise, no smoking and drinking. You try to quit smoking and limit your alcohol intake. So we've already talked about all of them. But don't try to lose weight during pregnancy. You should talk to your healthcare provider first about how much weight is healthy for you to gain during pregnancy. You should lower your stress. Learn relaxation techniques, deep breathing exercises, mindful meditation, yoga, and other helpful strategies. Get an adequate amount of sleep, typically 7 to 9 hours. As prescribed by your healthcare practitioner, take drugs to control any current risk factors for heart disease, such as high blood pressure or cholesterol, or to lower the chance of acquiring type 2 diabetes. Now, prevention of type 1 diabetes. Type 1 diabetes cannot be stopped. Due to the autoimmune nature of type 1 diabetes, your body actually attacks itself. The reason why a person's body would attack itself is unknown to scientists. Genetic alterations are just one of several potential contributing variables. So from this picture, preventing type 1 diabetes. autoimmune diabetes acceleration prevention trial. Then type 1 diabetes, infection, genetic factors, surgical biomarker diet. Type 1 diabetes. Type 1 diabetes cannot be stopped. But we talk about that. So let's look at diabetes risk factors. We've already talked about prevention of diabetes. We talk about how to prevent type 2 and gestational diabetes. We've also talked about how to prevent type 1 diabetes. So now let's go on to the risk factors for diabetes. Now let's look at the risk factors for type 1 diabetes. Risk factors for type 1 diabetes are not as clear as for pre-diabetes and type 2 diabetes. Known risk factors include family history, that's having a parent, brother, or sister with type 1 diabetes. Age. You can get type 1 diabetes at any age, but it usually develops in children, teens, or young adults. Injury to the pancreas, such as by infection, tumor, surgery, or accident. Also, presence of autoantibodies, that's antibodies that mistakenly attack your own body's tissues or organs. Physical stress, such as surgery or illness. Exposure to illnesses caused by viruses. In the United States, white people are more likely to develop type 1 diabetes than African American and Hispanic or Latino people. So let's look at risk factors for type 2 diabetes. You are at risk for type 2 diabetes if you have prediabetes, if you are overweight, if you are 45 years or older, if you have a parent, brother, or sister with type 2 diabetes, that family history, if you have a family history. If you are physically active less than 3 times a week, if you have ever had gestational diabetes or given birth to a baby who weighed over 9 pounds, if you are an African American, Hispanic, or Latino, American Indian, or Alaska Native person. Also, some Pacific Islanders and Asian American people are also at higher rates. Also, if you have non-alcoholic fatty liver disease, you may also be at risk for type 2 diabetes. Also, having high blood pressure, having low HDL cholesterol, that's the good cholesterol, and high triglyceride level. Having polycystic ovary syndrome, having a history of heart disease or stroke, also being a smoker. Now, risk factors for gestational diabetes. You are at risk for gestational diabetes, that's diabetes while pregnant. If you had gestational diabetes during a previous pregnancy, also if you have given birth to a baby who weighed over 9 pounds, also if you are overweight, if you are more than 25 years, and also if you have a family history of type 2 diabetes. Also, if you have a hormone disorder called polycystic ovary syndrome. Also, if you are an African American, Hispanic, or Latino, American Indian, Alaska Native, Native Hawaiian, or Pacific Islander person. Your risk factors for gestational diabetes, we can see from this picture. Now, let's have a look at how to manage diabetes, the management of diabetes. Unlike many health conditions, diabetes is managed mostly by you with support from your health care team made up of the primary health care doctor, foot doctor, dentist, eye doctor, registered dietitian, nutritionist, diabetes educator, pharmacist. So ask for assistance and support from your family. teachers, and other significant individuals in your life as well. Although managing diabetes might be difficult, anything you do to enhance your health is worthwhile. You must administer insulin or wear an insulin pump every day if you have type 1 diabetes. Your body needs insulin to regulate blood sugar levels and provide energy. Insulin cannot be taken orally as a tablet. This is because it will be destroyed by the acid in your stomach before it could enter your bloodstream. Together with you, your doctor will determine the insulin kind and dosage that will work best for you. Additionally, you will require routine blood sugar testing. Ask your doctor what your goal blood sugar level should be and how frequently you should check it. You can avoid or delay diabetes-related problems by maintaining blood sugar levels as close to targets as you can. Life is full with stress, but it can make controlling diabetes more difficult. It can be more difficult to control your blood sugar levels and take care of your diabetes on a regular basis. Regular exercise, enough rest, and relaxation exercises can all be beneficial. You should discuss these and other stress management techniques with your doctor and diabetes educator. Everybody requires regular aerobic exercise. Those with diabetes are included in this. Aim for at least 150 minutes of moderate physical activity per week, or at least 30 minutes or more of moderate activity most days of the week. Throughout the day, there may be brief bursts of activity. Start out softly and increase your activity level gradually if you haven't been active recently. Also, try to limit your sitting time. If you have been sitting for more than 30 minutes, try to stand up and move around. Your blood sugar level is lowered by exercise by allowing sugar to enter your cells, where it is converted to energy. Your body becomes more insulin sensitive when you exercise. This indicates that less insulin is required by your body to deliver sugar to your cells. Schedule frequent consultations with your medical staff. They will assist you in adhering to your treatment strategy and, if necessary, provide fresh suggestions and methods. A balanced diet, maintaining a healthy weight, and engaging in regular exercise are all crucial components of managing diabetes. There is no particular diet for diabetes. Increase the amount of fruits, vegetables, lean proteins, and whole grains in your diet. These are nutrient-dense foods with a high fiber content that are also low in fat and calories. Additionally, you consume fewer sweets, processed carbohydrates, and saturated fats. In actuality, it's the healthiest diet for the whole family. Every so often, sugary meals are acceptable. They have to be accounted for in your food plan. It might be difficult to know what to eat and how much to consume, so you can develop a meal plan that suits your lifestyle, food preferences, and health goals with the aid of a qualified dietitian. If you have type 1 diabetes or require insulin as part of your management plan, this will probably involve carbohydrate counting. Eyelid cell or a pancreas transplant may be an option for certain persons with type 1 diabetes. Changes in lifestyle, blood sugar monitoring, oral diabetic medications, insulin, or a combination of all are the main components of managing type 2 diabetes. So, monitoring your blood glucose. How do you monitor your blood sugar level or your blood glucose level? You may check and record your blood sugar up to 4 times each day or more frequently if you are on insulin, depending on your management or treatment plan. The only way to guarantee that your blood sugar level stays within your desired range is through careful monitoring. Non-insulin using type 2 diabetics typically check their blood sugar much less frequently. People who use insulin therapy may also decide to use a continuous glucose monitor to track their blood sugar levels. Although the glucose meter hasn't entirely been replaced by this technology, it can reduce the number of finger sticks required to check blood sugar and offer useful insights into trends in blood sugar levels. Even with careful treatment or management, blood sugar levels may fluctuate without warning. You will learn how food, exercise, medicine, sickness, alcohol, and stress affect your blood sugar level with assistance from your diabetes care team. You will discover how fluctuations in hormone levels affect how much blood sugar ladies have. Your doctor may also advise routine A1C testing to determine your average blood sugar level over the last 2 to 3 months in addition to daily blood sugar monitoring. A1C testing provides a more comprehensive picture of the effectiveness of your diabetes treatment regimen than repeated daily blood sugar checks. A higher A1C level could indicate that you need to adjust your oral medication, insulin regimen, or diet. Your target A1C goal may vary depending on your age and numerous other factors, such as other medical illnesses you may have or your ability to sense when your blood sugar is low. The American Diabetes Association advises an A1C below 7% for the majority of diabetics. So ask your provider what your A1C target is. So blood sugar and glucose monitoring using the glucometer. Insulin. People with type 1 diabetes need insulin therapy to survive. Many people with type 2 diabetes or gestational diabetes also need insulin therapy. There are numerous insulin formulations, including short-acting, also known as regular insulin, rapid-acting, long-acting, and intermediate choices. Your doctor can advise using a variety of insulin kinds both during the day and at night, depending on your needs. Because stomach enzymes interfere with insulin's ability to work, it is not possible to take insulin oral to lower blood sugar. An insulin pen or a thin needle and syringe are frequently used to inject insulin. Another possibility would be an insulin pump. The pump is a small externally worn device around the size of a compact telephone. A catheter is implanted beneath the skin of your belly and connected by a tube to the reservoir of insulin. A catheter that is implanted beneath the skin of the abdomen is connected to an insulin reservoir through a tube that is worn outside the body as an insulin pump. The continuous and with food delivery of a predetermined amount of insulin is programmed into insulin pumps. There is now also a wireless tubeless pump available. Specific insulin dosages can be programmed into an insulin pump. In accordance with meals, level of exercise, and blood sugar level, it can be modified to release more or less insulin. For type 1 diabetes, the Food and Drug Administration have approved for artificial pancreases. Another name for an artificial pancreas is closed-loop insulin delivery. The implanted gadget connects an insulin pump to a continuous glucose monitor, which measures blood sugar levels every 5 minutes. When the monitor shows that more insulin is required, the gadget automatically administers the appropriate dosage. There are currently more closed-loop artificial pancreas systems being tested in clinical settings. So from this picture, you can see that someone is injecting insulin. Oral or other drugs. Your doctor may occasionally also recommend alternative oral or injectable medications. Some diabetic medications encourage the pancreas to produce more insulin. Others stop your liver from producing and releasing glucose, which reduces the amount of insulin required to transport sugar into your cells. Others prevent the stomach or intestinal enzymes from breaking down carbohydrates, reducing their absorption, or increase the sensitivity of your tissues to insulin. It is possible to employ SGLT2 inhibitors, a different type of drug. They function by blocking the reabsorption of filtered sugar into the blood by the kidneys. The sugar is instead removed through the urine. So transplantation or pancreas transplant. An option for some persons with type 1 diabetes is a pancreas transplant. If a pancreas transplant were to be successful, insulin therapy would not be necessary or would be unnecessary. However, transplants don't always work. These procedures also carry significant dangers. Immune suppressing medications must be used continuously to prevent organ rejection. The adverse effects of some medications might be severe. As a result, recipients of transplants are typically those who cannot control their diabetes or who also require a kidney transplant. A pancreatic islet transplant is another kind of transplant. This procedure involves replacing the damaged islet cell clusters in your pancreas with transplanted islet cell clusters from an organ donor. So this is the donor, pancreas donor, and this is the recipient. So donor pancreas with portion of donor's small intestine from this picture. Bariatric surgery. Bariatric surgery or weight loss surgery may be beneficial for some type 2 diabetics who are obese and have a body mass index over 35. There are various kinds. Laparoscopy can be used to perform the majority of procedures in a minimally invasive manner. Only small incisions and extremely small devices are used during laparoscopic procedures. Blood sugar levels have significantly improved for those who have undergone a gastric bypass. However, the long-term dangers and advantages of this surgery for type 2 diabetes are not yet understood. Diabetes can be caused in large part by obesity. Obese individuals are 10 times more likely to get the illness. Foods with a lot of fat and carbohydrates raise blood fatty acid levels and cause lipid or fat buildup in the muscles, and liver. Inflammation and insulin resistance are increased by this. The pancreas eventually stops producing enough insulin. So this is the gastric bypass surgery before and after the surgery. Immunotherapy. Immunotherapy. Immunotherapy is a different treatment option or managerial option being investigated for type 1 diabetes. Immunotherapy, which uses medication to disable the immune system components that cause type 1 diabetes or the type 1 disease, has potential because type 1 is an immune system disease. Alternative medicine. In certain investigations, a variety of drugs were found to enhance the body's capacity to metabolize insulin. Other studies come up empty when it comes to benefits for decreasing A1C levels or controlling blood sugar. There are now no alternative therapies that are advised to help everyone manage blood sugar because of the contradictory results. So, managing gestational diabetes. Managing gestational diabetes. Do not stop taking the medications that your doctor has recommended if you decide to attempt any alternative therapies. Talk to your provider, that's healthcare provider, before using any of these therapies. Verify that they won't have negative effects or interfere with ongoing therapy. Additionally, neither conventional nor alternative therapy can reverse diabetes. Never stop taking insulin if you are on insulin therapy for diabetes, unless your healthcare physician instructs you to. Controlling your blood sugar level is essential to keeping your baby healthy. It can also keep you from having complications during delivery. In addition to having a healthy diet and exercising regularly, your treatment or management plan may include monitoring your blood sugar. In some cases, you may also use insulin or oral drugs. Your healthcare provider will monitor your blood sugar level during labor. If your blood sugar rises, your baby may release high levels of insulin. This can lead to low blood sugar right after birth. So, health impact of diabetes. The health impact of diabetes. And from this picture, we can see a lot of them. A significant contributor to blindness. Diabetic retinopathy results from cumulative long-term harm to the retina's tiny blood vessels. Diabetes has caused nearly 1 million people to become blind. Also, people with diabetes are more likely to have poor outcome for several infectious diseases, even including COVID-19. Cardiovascular disease, that's heart and blood vessel disease. Diabetes significantly raises the risk of numerous heart conditions. These include heart attacks, strokes, arterial narrowing, and coronary artery disease with chest pain. Diabetes increases your risk of developing heart disease or stroke. Nerve injury, that is neuropathy. The walls of the tiny blood arteries, that the capillaries, that feed the nerves might become damaged by an excessive sugar intake, especially in the legs. The tingling, numbness, burning, or pain that may result from this typically starts at the tips of the toes or fingers and progressively moves higher. Neuropathy, that is nerve damage, in the feet raises the risk of foot ulcers, infection, and ultimately the requirement for limb amputation when combined with diminished blood flow. Damage to the nerves related to digestion can cause problems with nausea, vomiting, diarrhea, or constipation. For men, it may lead to erectile dysfunction. Kidney damage, that is nephropathy. The kidneys hold millions of tiny blood vessel clusters that filter waste from the blood. Diabetes can damage this delicate filtering system. Skin and mouth conditions. Diabetes may leave you more prone to skin problems, including bacterial and fungal infections. Hearing impairment. Hearing problems are more common in people with diabetes. Alzheimer's disease. Type 2 diabetes may increase the risk of dementia, such as Alzheimer's disease. Depression. Depression symptoms are common in people with type 1 and type 2 diabetes. So now another question. Does eating sugary foods cause diabetes? This is a common question that people normally ask. Does eating sugary foods cause diabetes? Diabetes is not directly brought on by sugar. Eating foods with a lot of sugar might make you gain weight, which increases your chance of getting diabetes. In addition to causing weight gain, eating more sugar than is advised by the American Heart Association, who recommends no more than 6 teaspoons, that's 25 grams of sugar per day for women, and 9 teaspoons, that's 36 grams per day for men, can have a number of negative health effects. All of these health risks increase the likelihood of developing diabetes or worsening its complications. Weight gain can raise blood pressure, cholesterol, and triglyceride levels. Weight gain can also increase your risk of cardiovascular disease. It can also cause fat buildup in your liver, and it can also cause tooth decay. Another question, can I use artificial sweetness if I have diabetes? According to M. Regina Castro, that's MD, according to her, you can use most sugar substitutes if you have diabetes, including saccharin, aspartame, acesulfame potassium, neotame, advantame, sucralose, and stevia. Artificial sweetness are also known as sugar alternatives, calorie-free sweetness, and non-nutritive sweetness. They provide sugar sweetness without the calories. In comparison to sugar, artificial sweeteners are much sweeter. As a result, artificial sweeteners need to be used sparingly to sweeten food. For this reason, food sweetened artificially may contain fewer calories than food sweetened with sugar. Your blood sugar level is unaffected by sugar alternatives. The majority of artificial sweeteners are actually regarded as free foods. Free foods don't count as calories or carbohydrates on a diabetes extent since they have fewer than 20 calories or 5 grams or less of carbohydrates. But keep in mind that even when foods contain artificial sweeteners, other components may still have an impact on your blood sugar level. According to several studies, switching to artificial sweeteners from sugar-sweetened foods and beverages may not be as advantageous as previously believed. When artificial sweeteners are consumed in high quantities, this might be especially true. However, more study is required. Be careful when using sugar alcohols such as mannitol, sorbitol, and xylitol. Your blood sugar level can rise as a result of sugar alcohols. Additionally, sugar alcohols may also give some people diarrhea. Amputation and diabetes. Amputation and diabetes. Diabetes that is not under control can impact blood flow or poor circulation. You are more prone to developing cuts and sores that can result in infections that can't fully heal if you don't have access to oxygen and nutrients, which are carried by the blood. The effects of inadequate blood flow are more likely to manifest in areas of your body that are farthest from your heart. Therefore, if an infection spreads and healing is subpar, parts of your body, including your toes, foot, legs, and fingers, are more likely to be amputated. Regular foot care and good diabetes management help prevent painful, difficult to treat foot ulcers that may necessitate amputation. Nerve injury and impaired blood circulation are two diabetes consequences. These issues can result in skin sores or ulcers on the foot, which can quickly get worse. The good news is that preventing foot ulcers can be accomplished by managing your diabetes and taking proper care of your feet. If you get a foot ulcer, you should seek medical attention right away. Foot ulcers are the most common cause of lower leg and foot removals or amputation. Tissues and bone are severely harmed by an ulcer that won't heal. It might necessitate the surgical amputation of a toe, a foot, or a portion of a leg. Some people with diabetes are at higher risk than others. Factors that lead to a higher risk of amputation include high blood sugar levels, smoking, nerve damage in the feet, calluses or corns, foot deformities, poor blood circulation to the arms and legs, that's the peripheral artery disease, a history of foot ulcers, a past amputation, vision problems, kidney disease, high blood pressure above 140/80 millimeters of mercury. Can diabetes kill you? Yes, it's possible that untreated diabetes, severely high or low glucose levels, could do irreparable damage to your body if it goes misdiagnosed and uncontrolled. Diabetes can result in a coma, heart attack, stroke, renal failure, and heart failure. These issues may result in your demise. The main cause of death in persons with diabetes is specifically cardiovascular disease. Can diabetes cause hair loss? Yes, diabetes can result in thinning hair. Blood glucose levels that are chronically high can result from uncontrolled diabetes. In turn, this causes blood vessel damage and reduced blood flow, which prevents oxygen and nutrients from reaching cells like hair follicles that require them. Changes in hormone levels brought on by stress can impact hair growth. Alopecia areata, a disorder that causes hair loss in people with type 1 diabetes, can also be brought on by the immune system attacking oneself. Can you be born with diabetes? That is it genetic? Type 1 diabetes does not develop at birth, but it typically manifests in childhood. Diabetes and prediabetes progress gradually over time. During pregnancy, gestational diabetes can develop. Genetics may contribute to or play a role in the development of type 1 diabetes, according to scientists. Its development could be prompted by a virus or something in the environment. You are more likely to get type 1 diabetes if someone in your family has the condition. You run a higher chance of getting prediabetes, type 2 diabetes, or gestational diabetes if your family has a history of any of these conditions. So, it's been a long lecture. Thanks for staying with me. Thanks for watching. And once again, don't forget to subscribe to this channel, like this video, share this video, and leave all your comments or questions in the comment section. Have a nice day. Thank you.